The Affordable Care Act just isn't that affordable anymore. Has it ever really been affordable? Not if you don't qualify. Bad news, good news. I don't think it's necessarily good news. It's definitely not the greatest news, but let's go ahead and see why they are raising the rates in 2025. Anybody else surprised by this? Not me, not at all. But the key factors that they indicate for the reason as to why the premiums are increasing may interest you. Let's talk a little bit more about this. Hello, everyone. Welcome to Broker Evan Pollard. I am licensed in life, health, accident, and sickness. I assist those who are under 65 as well as 65 and older for the ACA, on and off exchange, as well as Medicare. Today, we are talking about the ACA, more specifically, rates going up. Before we get into this, please like this video, comment, and share if you care, and subscribe to my channel. Make sure you hit that notification bell so you don't miss a single video that I post. Today, I'm going to review a couple of articles for you before I get into some videos that I found that also correlate with the reasons why they are raising the rates next year for the under 65 market. A lot of the secondary articles that you may read out there are derived from the Kaiser Family Foundation and their research on the topic at hand. As it states at the beginning of the article, ACA marketplace insurers are proposing a median premium increase of 7% for 2025, similar to the 6% premium increase filed for 2024. I want to move down to the main point that I want to bring up is that insurers cite growing healthcare prices, particularly for hospital care, as a key driver of premium growth in 2025, as well as growing use of weight loss and other specialty drugs, according to the KFF's examination of publicly available documents. So they give us a little chart here. On average, ACA marketplace insurers are raising rates by about 7% in 2025. This year, increases in the prices insurers are paying for medical care tend to affect premiums more than growth in the utilization of care. Insurers say workforce shortages and hospital market consolidation, which can put upward pressure on healthcare costs and prices, are increasing 2025 insurance premiums. Just to break that down alone, from the information that I know, a lot of these providers in the industry are experiencing some sort of downfall. Because these health insurers are paying more in hospital care costs year over year, it is in turn causing them to then charge you, the consumer, to make up for that profit loss. And also, as the article stated, shortages within the workforce. We did experience a lot from 2020 to where you saw doctors and nurses leaving voluntarily or involuntarily, which has also affected the availability to receive care. Another huge factor that is causing these insurance companies to raise their prices is the cost of prescription drugs. I've spoken a little bit about the Inflation Reduction Act in my Medicare 101 video. Whatever these carriers are going through on the Medicare side is going to affect the under 65 side automatically. Like it's without a doubt, no questions asked. And it's very important to pay close attention to all of the trends that are occurring because essentially we are going to be paying for it as a whole, whether it's dollars out of our own pocket, personally giving it to these companies, or whether it's going to be paid through our tax dollars. We're going to be paying for it. Everyone is. As this article goes on to say, meanwhile, growing demand for Ozempic, Wegovy, and other costly GLP-1 drugs, which are used to treat diabetes and obesity, is increasing prescription drug spending. This video has some really good information about GLP-1s because I did not know what a GLP-1 was when I first read that KFF article. I was like, what? GLP-1s? What does GLP stand for? So let's look at it.
Luciano stops thinking about food because of an injection that slows down the emptying of the stomach. It reduces his appetite by tricking his brain into thinking that he's already eaten. It mimics the effect of a naturally occurring hormone. glucagon like peptide 1, or GLP 1. This is how the hormone works with healthy people. Eating triggers the release of GLP 1, which signals food intake to the brain. The brain tells us we're full, and we stop thinking about food. In people with obesity, production of this hormone is impaired, and those cravings can be prevented by injecting an artificial GLP 1. The same substance was originally developed to help diabetes patients to control their blood sugar levels by stimulating the pancreas to produce more insulin. The weight loss was an unintended coincidence. People with type 2 diabetes lost weight as soon as they began treatment with the medication.
Now, if you want to think about it, breaking it down, when you have your insurance plan and you're thinking about the prescription drug costs that you have, yes, you may have a deductible, maybe, that you pay for. Sometimes you don't. But if we're talking about a deductible that you pay, let's say you satisfied that. Then the insurance company says, okay, for the plan that you selected, you have a co-payment, a flat rate, or you have a co-insurance, which is a percentage of what you would pay for that drug. Let's say Ozempic is $1,000 per month and your co-insurance is only 10% of that. The insurance is going to foot the bill for $900 for that expensive prescription drug while you only pay 100. It's good for you, but for the insurance carrier, they're footing the bill more and more for these expensive drugs. Hence why we're seeing a rate increase for 2025.
List price of Ozempic in the US is $968. It's as low as $59 in China, about $200 in Turkey, and less than $100 in parts of Europe. And
The next article that I want to bring to your attention is from ACIS. I believe it's ACIS. I hope it is. It lists ACA premiums set to rise in 2025. This was published one day after the Kaiser Family Foundation had posted their article. Getting right to it, at the beginning of their article, growing demand for GLP-1 drugs like Ozempic and Wegovy and hospital consolidation could help drive up the cost of Affordable Care Act coverage next year by 9% or more. So they're saying even higher than the 7% that KFF is predicting. But they're taking this information from a preliminary review by the Peterson Center on Healthcare and KFF. Of course, they state why it matters. While most enrollees in the market get subsidies and won't have to foot the added bill, premium increases generally result in higher federal spending on subsidies, the analysis notes. Again, many people do receive their advanced premium tax credit on the healthcare marketplace, which helps bring down the cost of their insurance premium on a monthly basis. Essentially, what does that mean? You may see an increase in your rates for next year. I'm not going to say that you won't or you will. Everyone is in a different state. Everyone has different income. But I will say at the end of the year, you do have to file your taxes regardless. You're just going to have to wait and see how it's going to affect you during tax time. But nonetheless, because we do get those subsidies, many people aren't blatantly going to notice the increase of the premium, but it'll definitely be there and it's definitely going to creep up, especially for the people who don't qualify for the subsidy and are on the ACA on exchange coverage. It's just something to think about. And one last thing that I want to point out from this article is the bottom line. Medical inflation has picked up and now exceeds the growth of non medical prices, a big change from 2021 to 2023. ACA plans are adjusting to keep pace and reflect their higher costs and overhead. Directly under that article, it goes straight into this chart that shows the average monthly premiums of the lowest cost silver healthcare plan. Now, if you didn't know, on the healthcare.gov website, you have a number of plans to select from, and typically you're going to see the catastrophic, bronze, silver, gold, and sometimes platinum that may be offered in your area. The silver plan is going to be the most popular plan because that is where the cost sharing reductions start to kick in, and if you choose a plan that is lower than the silver, you will not be able to receive your premium tax credit on those plans. And that is why it is going based off of the silver plans in this chart. But as you can see, this was actually published in 2022. And that is why you see the years from 2018, 19, 2020, 2021, 2022, and 2023. We did see a slight dip in the cost of the average cost of the premiums from 2020 to 2022, but then it had a significant jump for 2023, surpassing years prior. And even when we're talking about the jump in premium, we did also see from 2023 to 2024 an average of about 7% increase in the premiums. And then we're seeing another average of 7 to 9% increase in premiums for the next year going into 2025. That is all that I have for you today. As far as the healthcare industry, what to expect coming up here in 2025 as we do enter the enrollment period, the open enrollment period for the ACA on November 1st. Please do your due diligence, check on that annual change of notice, and also shop around for some rates. Again, you can go to my Health Sherpa, run a quote, put in your information. If you want to see if you qualify for your premium tax credit, you can put that information in there as well, and it'll give you an estimate of what you may qualify for. If you need help along the way, feel free to give me a call at my phone number that is listed on the website of Health Sherpa, and I will be happy to help. Thank you so much for tuning in. I'll see you guys next time.